Video's topic is structures passing through thoracic inlet. We'll see muscles, arteries, nerves, veins, lymphatics, other structures through thoracic inlet and thoracic inlet syndrome. Muscles, sternohyoid, sternothyroid, longus cervicis. Arteries, internal thoracic, brachiocephalic trunk, left common carotid, left subclavian, superior intercostal arteries. Nerves, vagus, left recurrent laryngeal, phrenic, first thoracic, sympathetic chains. Veins, brachiocephalic, first posterior intercostal and inferior thyroid veins. Lymphatics, thoracic duct. Other structures, anterior longitudinal ligament, esophagus, trachea, cervical pleura, apices of lungs. Thoracic inlet syndrome is compression of subclavian artery and lower trunk of brachial plexus by hypertrophied scalenus anterior muscle or a cervical rib. Symptoms: numbness, tingling, pain, wasting of small muscles of hand, pallor, coldness of upper limb, weak radial pulse.